Hello and welcome to the latest Q&A with Asthma UK and the British Lung Foundation's in-house GP, Dr. Andy. He'll be giving you some top tips for looking after your lung health now that the weather's turned colder. And stay tuned for some top tips from one of our lovely helpline nurses around the importance of inhaler technique. As always, if this video helps you, please do let us know by giving us a like, leaving your comments, or subscribing to our channel today. And if this video helps you and you find our health advice useful, please do consider leaving a small donation today to help us continue defending the nation's lungs.
Hi Andy, we're getting calls from parents of children with either undiagnosed or poorly controlled asthma. So what advice could you give people in that position?
There are many reasons why a child at the moment might not have a diagnosis. So I think if you think your child has asthma, see our webpage and we'll put a link up to that shortly. But also some children are just too young to do tests that help to diagnose asthma or prove the asthma. And then you add to that the pandemic as well. So over the last year, lots of the tests that we use to diagnose asthma have not been available. So there's a bit of a backlog of people who haven't yet got a diagnosis. So in all of these cases, if your child is getting symptoms such as coughing, wheezing, breathlessness, then the healthcare professional should be able to start preventative treatment for asthma if they suspect it, even without any of those tests being done. So if you're not in need treatment, but they do think it's asthma, then make sure you contact them to make sure that they get started on some treatment to help prevent symptoms and preventing flare-ups as well. So if your child already has a diagnosis of asthma and it's poorly controlled, then what I encourage all parents to do is make sure their child is taking their preventive medication regularly. Not just regularly, but correctly. So check their inhaler technique. And you can do this by visiting our videos on our webpage, which help to show people how to use any inhaler with and without spacers, so they know they're getting the drug in to do the job it's meant to be doing. Everybody with asthma, so children and adults, should have an asthma action plan. And there's different ones depending on how old you are. If you don't have one, then you can download one from our website. And again, we'll put a link on there for you so you can download it. And then you can work through that with your healthcare professional next time you're in contact. And if your child is getting asthma symptoms or needing their reliever inhaler 3 or more times every week, then you need to make contact and try and get a review to make sure that we're doing everything we can to help keep your child well and help prevent those symptoms. If you need help and you need support, or you're worried about your child and you can't get hold of your GP, then calling 111 is appropriate. There's certainly the right people there to help direct you to the right people, to give you the right help and make sure you get the treatment for your child that you need.
So I'm just going to take a minute to say that all our advice is correct at the time of filming, but do check out the links in the description below for the latest updates from Asthma UK and the British Lung Foundation. And if you're finding this video helpful, please do let us know. Leave a comment or like the video or subscribe to our channel today. For our next question, we're going to hear from Lanny, who is one of our brilliant helpline nurses. Lanny, inhaler technique can be a really important part of managing a lung condition. So could you explain why someone might need to improve their technique? And tell us where we can see some demonstrations of inhaler techniques, please.
Hi, Rebecca, that is a great question. So whether you've been prescribed an inhaler for many years, been given a new device, or this is a new diagnosis and treatment for you, inhaler technique and reviewing your inhaler technique is one of the core foundations of asthma management. You may be prescribed the perfect medication to control your asthma symptoms, but if you're not using your inhaler correctly, this medication will not be reaching its full potential. Using the right inhaler technique means that the medication is getting breathed in straight into your lungs where it's needed, and this will hopefully result in better control of your asthma symptoms. If your inhaler technique does need improving, not only may your asthma symptoms be worse, but it may also mean that you're more likely to get side effects such as oral thrush or a sore throat. This is because not all of the medication will be going straight into your lungs, but some of it will be hitting the back of your throat or sitting in your mouth. Even if you've been on the same inhaler for many years, it's good to ensure that you are still using your inhaler correctly and revisiting this at regular intervals. The Asthma UK website has a variety of different inhaler technique videos using all different devices. So please have a look at it and check that you're using your inhaler correctly. If you're still struggling with the device that you've been given for your asthma, then please speak to your pharmacist or healthcare professional for further guidance.
Thanks, Lanny. Andy, as the weather gets colder, what should people with lung conditions watch out for and be doing to keep themselves well?
Winter brings a lot of issues that can affect people with any respiratory disease. So firstly, cold air can irritate the lungs. You've got viruses spreading more freely, such as cold and flu, and now COVID as well. There's lots of damp and mold in the air, and that can be from in the house or from rotting vegetation outdoors and in the garden. Dust mites can sort of come back to life and come around, and that can be an issue for some people with lung disease. And then putting central heating on, open fires and wood burning stoves, they can all have different issues for different people as well. So the general advice I give everybody is that if you're on any preventive medication, especially if you've got asthma or COPD, make sure you're taking it regularly as it's being prescribed. Make sure you carry any reliever inhaler with you at all times, because you never know when these triggers can set you off and cause you a problem. Make sure you follow your self-management plan or your asthma action plan if you have one. And if you don't, look on our website so you can download one and have a good look at them. Make sure that you respond or attend any reviews that you get given. It's always a good opportunity to make sure that we're keeping your lung disease looked after as best as it can. Make sure we're doing everything to keep you well, especially as we head into the bad winter months. And finally, and I suppose the most important thing is if you're getting chest symptoms and they're getting worse or you're worried about them, make sure you at least contact your GP surgery or the NHS or get advice before it becomes much more serious. Leaving your symptoms to get worse means it's harder to treat and you're more likely to end up in hospital, so make sure you get early advice. The nose acts as a filter. It helps to keep things out of the airways, but it also helps to warm up the air as you breathe it in. So breathing in through your nose rather than your mouth means that your lungs are less likely to get affected by cold weather. Something Asthma UK have been pushing for the last few years is wearing a loose scarf over your mouth or nose to help warm up the air when you're going outdoors, and this could be useful for anybody with any lung condition. So give it a try and see if that helps you out. It's really important to keep your house warm, and sort of advice that we give is to keep your house heated to at least 18 degrees. For some people with worries about heating costs at the moment, if you're having any problems with that side of things, the British Lung Foundation have got a great website helping people to work out what to do if they are struggling with the cost of heating. There's various things that you can apply for to get help. And I suppose finally, I'm just going to sort of say it's really important to get yourself vaccinated. So the flu vaccine, most people are getting now. If you haven't been invited for yours, ask if you can get yours done. COVID vaccinations, of course, and whether you've had yours or your boosters, make sure you respond to any invites that you get there. And many people with lung disease can also get the pneumococcal jab, which protects against certain types of pneumonia. And the people who should be eligible for this are over 65, or they might be younger than 65 with a long-term lung condition such as pulmonary fibrosis, COPD, bronchiectasis, or some of the more severe forms of asthma. So if you fall into those categories, then do ask your GP surgery whether you can get the vaccine for that one as well. Try and do your best with your lung condition. Try and make sure you're taking your medications regularly. Be sensible in terms of keeping warm and washing your hands and avoiding people who've got symptoms. And hopefully you can stay well and safe this winter.
Thank you so much for watching today's Q&A with Dr. Andy, brought to you by Asthma UK and the British Lung Foundation. If you found what we've been discussing today useful, please do like the video, leave your comments and subscribe to our channel today. You can find lots of useful links in the description below, and please do remember, if you're able to and you find our health advice useful, please do consider making a small donation today to help us continue defending the nation's lungs.